Governor Doug Ducey allowing some businesses, in fact many of them, to reopen across the states and citing data showing a downward trajectory, at least in some key areas. But does the math really add up? ABC 15 investigator Melissa Blasius and ABC 15 data guru Garrett Archer teaming up with this fact check.
Governor Doug Ducey finding a way to ease his stay-at-home order without violating White House guidelines. Notice what he circled in his PowerPoint above his head.
This does provide flexibility for states to tailor application of these criteria to local circumstances.
Ducey lays out the case with 2 points. One, the gold line in this graph, the percentage of patients reporting COVID-19-like symptoms compared to all patients showing up at the hospital. That has dropped since the date of the stay-at-home order.
What you've seen in the successive weeks following is a downward trajectory, both in COVID-like illnesses and influenza-like illnesses.
Other hospital data seems to conflict with the idea of a downward trend, showing a more steady daily number of coronavirus patients in emergency rooms, inpatient beds, and ICU beds. In another governor graph, Ducey shows another downward trajectory in positive cases versus total coronavirus tests.
If you follow the trend line here, you can see that we have been steady across the course of these tests with a downward trajectory. That downward trajectory is very positive.
The governor says we've dropped to 6% positive of total tests. But strangely, this data does not match the state's own health services dashboard on coronavirus, which says 8%. Nor does it match the total number of tests conducted. When we asked about these discrepancies, we were told the health department's calculations were incorrect.
I've never seen a government agency put out information and then say that, well, this information is not entirely accurate, so you'll have to take this other set of information and say that this one's accurate. It's very rare.
It also makes the governor's statements hard to fact check at a time when outside groups looking at the coronavirus curve indicate at best Arizona is plateauing, not reducing the spread.
Arizona, I think, is still kind of in the midst of an outbreak. There's still an upward trend in new cases. The positivity rate is also continuing to increase. And I think that the testing is perhaps not quite where it should be.
It looks like we have many more weeks of active transmission, that this is not going away soon. It's something that we're going to need to continue to be worried about, because our risk of catching this virus still remains relatively high. Because these numbers do indicate there's quite a bit of transmission in the community.
ABC 15 is asking for the data behind the governor's new numbers, and we'll share that with you when and if we receive it, so you can make informed decisions about your life and health. I'm investigator Melissa Blasius, ABC 15 Arizona.